Hello, my name is Dr. Randi Hagerman. I'm here to tell you a little bit about Fragile X syndrome and Fragile X carriers. You or someone that you know, such as your child, may have recently been diagnosed with a Fragile X mutation, and I want to tell you a little bit more about this disorder. There are many strengths that individual children with Fragile X syndrome have. They can also have some difficulties, but they are wonderful children. They give their families so much pleasure. These kids are adorable and often very sensitive. These are the greatest kids to work with. The adults are so funny too. They're a pleasure to be around. They can have behavior difficulties at times, but they respond well to treatments and interventions. And the families are the most supportive in the world. They are marvelous. You perhaps may be a little confused about the diagnosis or have received a lot of information that is difficult to understand at first, but as you read more and hear more about Fragile X syndrome, I think that a lot of your questions will be answered.
William suffers from Fragile X in the fact that he has low muscle tone, he has large ears, flat feet. He also has the developmental delay, of course. He has autism and high anxiety.
Connor was diagnosed as mosaic Fragile X about 3 months ago. He was diagnosed as part of the process of trying to find out why he was so delayed developmentally. He wasn't walking or talking or playing like other children would.
My youngest son, Bryn, was diagnosed with Fragile X syndrome after his cousin Connor was diagnosed. So my sister's got a 2-year-old who's just been diagnosed with autism, and they tested his blood and they found Fragile X, and because it's genetic we thought we should test Bryn, and he was positive for a full mutation.
Fragile X syndrome is the most common known inherited cause of developmental disability and the most common single gene cause of autism. The cause of the syndrome is a result of the expansion or lengthening of a gene on the X chromosome. When the gene lengthens, it switches off production of a protein that is normally vital for normal mental health function.
Everybody has the Fragile X gene, but the mutation that we associate with Fragile X syndrome is an expansion of the front part of the gene. So in a female who's a carrier of just a small expansion, or premutation as we call it, her other X is normal. So there's a 50-50 chance that she would pass on the mutated X to her children.
Men who carry the Fragile X premutation carry it on their X chromosome. So men have only one X and one Y chromosome. So if they pass their Y chromosome on, that's going to be to a son. They can never pass on Fragile X to their son, but they will always pass on the Fragile X gene to all of their daughters.
The diagnosis of mosaic Fragile X for Connor was a real shock for us because he's the first one who's been diagnosed in the family. So we were looking for a cause for the reflux and the delayed development, and we had gotten an autism diagnosis, so we thought we were there. So it was a real shock because we didn't expect anything else to come out of it. So I think shock, is this possible? Where did this come from? It was just a moment in this kitchen that I can't describe.
When Bryn's blood test came back, we were devastated. We straight away were thinking about the very, very worst possible scenario. We read lots of literature, and it says lots of things about intellectual disability and also physical disability, and we assumed that Bryn was going to struggle and never leave home and not have relationships, and how would it affect us financially. So it really rocked us to the core, I suppose. And then we got to calm down and realise that Bryn is still Bryn. He hasn't changed, and he's just beautiful. He's such a smiley little boy, and if he doesn't develop, it won't change that he's still a beautiful person, and we love him and we'll always love him. So the initial shock is wearing off, but at first it was very, very difficult.
I think Fragile X has been affecting our family for a long time and we didn't know it. So you've got all of those impacts leading up to today. With my partner and I have been dealing with a little boy who doesn't sleep, and all the sleep deprivation and all of those stresses that have happened with having this baby who has had a lot of special needs. And now that we've got this diagnosis, it's now impacting us we're now having to change a little bit of the focus of our lives. We're talking about therapy, and we're talking about long-term goals and planning for him. So I think it puts a lot of stress and a lot of responsibility on a family.
Well, basically there's the anxiety, there's the fear. You don't know what to expect, you don't know what's ahead of you, you don't know what. Basically your head goes forward to the future. Well, what's their future going to hold? What's going to happen? There's just that constant just anxiety and fear, basically, of what's going to happen in the future, and you don't know. It's the not knowing that's the hardest, I find.
I think I vacillate between acceptance and this isn't happening. It's still very new for us. So the days where we're going to therapy and Connor's achieving things and doing things I think there's more acceptance. And the days where he's a bit manic and he's sitting on the floor, just sitting there pressing a button or banging a door or something, then not so much.
Families who get a diagnosis of Fragile X syndrome are often devastated by the news. It's very important for families to be aware that providing that they implement the appropriate treatment and management strategies, that their family member can achieve a very fulfilling and healthy lifestyle.
Will, as I said, has brought the family together. He it hasn't affected us in the sense that it hasn't caused rifts or anything like that, which in some families it can. It hasn't done anything. He's just a part of the family. He's who he is, and everyone accepts him for that.
They're beautiful. They're so happy, and I think sometimes they go through so much more difficulty just living inside their own body and coping what's happening to their bodies and figuring out how to grow up. It turns them into very patient, compassionate, beautiful, beautiful children. I think they're wonderful. Braden had a lot of feeding problems. He had severe reflux. He didn't like to put food in his mouth. He didn't like a lot of bright light or noises, and too much activity would make him very upset. He's a rocker, so he does rock a little bit. He's got low muscle tone, so he's not walking yet, and he's a little bit delayed with his speech and eating, and just that general development delay.
Fragile X syndrome presents in three main ways. There are physical features, there are developmental features, and there are behavioural and emotional features. In terms of physical features, Fragile X syndrome classically presents with people with a long narrow face, large protuberant ears and a high forehead, although those features are not always seen. Developmental problems seen in Fragile X syndrome include intellectual disability, also known as cognitive disability, which means they have difficulty understanding the world around them. They can also present with a range of learning difficulties, in particular with areas such as maths and other abstract academic concepts.
The most common behavioural characteristic seen in an individual with Fragile X syndrome is that of anxiety. Significant social anxiety, avoidance of eye gaze, and at times withdrawal from social interaction. This can present in many different ways in other behavioural characteristics. When an individual with Fragile X becomes anxious, they may start rocking, they may hand flap, they may hum or self-talk and disengage from a particular situation. Many children with Fragile X syndrome struggle with attention. They may have symptoms more consistent with an attention deficit disorder, very distractible, a little bit hyperactive and impulsive in some of their behaviours.
The girls with Fragile X syndrome are usually less affected. Only about 25 to 30% have a significant intellectual disability, but another 30% have learning difficulties in school. They can also have shyness and social anxiety, again, poor eye contact.
The speech and language development is often very delayed in children, particularly in boys with Fragile X syndrome. When they do start talking, the words often are sporadic in the early on, and they then can become very repetitive in the words that they use or in the phrases that they use.
They can't organise and make sense of information that comes through their senses, and so they'll often be quite sort of hypersensitive in a way to things like smell and taste and visual information and touch and also sound.
The way a parent can minimise the behavioural symptoms that may be present in a child with Fragile X syndrome is to begin with early intervention as soon as possible. The development in Fragile X syndrome is very disordered. So children develop in speech and language, in their motor skills, in their self-help skills, how they do things for themselves, in their play skills, in their cognitive thinking and attention skills, all at a different rate and a different pace. For that reason, a number of different professionals need to be involved who would specialise in each particular developmental area, and that's why the need for the multidisciplinary approach. The therapists are speech and language therapists, occupational therapists, psychologists, and very often physiotherapists or a special educator.
Some children are oversensitive where they can't stand seams or things like that. He was the opposite. He needed pressure. He loved being hugged. He always wanted to be hugged. He loved being barefoot. As soon as he gets home, he throws his shoes off because he likes that feeling on his feet. We used to do brushing. There's a program they used to do that they brush their skins. You don't just do it, it's a special way of doing it. And that was through the OT. Lots of water play, lots of sand play, anything that was sensory and heavy subject, putting heavy things on him, swings, anything that gave him extra sensory stuff, he would love.
In the beginning stages of therapy, the therapist should be sitting down with the parents and goal setting together, and the goals should be very functional and what the child needs. So whether that's addressing their sensory processing issues, whether that's addressing their dressing skills or their feeding skills, decreasing a child's anxiety through the use of movement and additional techniques like deep pressure, and we use lots of weighted blankets and weighted belts and lots of different physical strategies in order to decrease their level of alertness or arousal to help keep them calm.
It's very important for parents to continue to keep their child and their family involved in the normal family activities that they enjoy. We like children to get involved in swimming activities, in going to the beach, in learning how to ride a bike, and being able to participate in normal games that they would be able to enjoy, birthday parties and family get-togethers.
Everyone works together. What you try to do is have everybody working together. You want your therapists to work in conjunction with your teachers and your teachers to work in conjunction with you. Basically, it's got to be a whole team approach.
Connor has started occupational therapy and speech therapy for his Fragile X. He's also about to have some in-home therapy, just a short, I think it's 6 sessions at home. And he's also been enrolled in a special education playgroup where he'll have more of his needs met in a playgroup environment. I think early intervention is the key to having the best outcome. A Fragile X child has to learn how to do so many things, both socially and physically. And my Connor's occupational therapist has really reflected that to us and said that they're seeing better and better results by these kids who are starting early and getting the benefit of all this therapy. So we're only 4 weeks into therapy with Connor, and I'm already getting tools from therapists on what I should do with him and how I should do them, and I'm seeing results. So today we built a little tower of blocks, and 6 weeks ago all my son would have done with those blocks is stick them in his mouth and chew on them. So I am thrilled because I knew that I needed to be doing something and I didn't know what it was, and now I'm getting more and more input and more tools, and he's responding, and it's wonderful.
The parents or the carers of the child need to be present at the therapy, because the main objective of interaction with the occupational therapist or the speech therapist is to be able to educate and support the parent in how to communicate and how to interact with that child on a daily basis. It's very important for parents to be very empowered, because they become the therapists 24 hours a day for their children.
The great thing about Fragile X is that every child is different, so you can really encapsulate that child's personality in every single session and really develop their skills that are really meaningful to them. Therapy and play is so much about having meaning for the child, and it's very difficult for a lot of children with Fragile X to have a really good insight into those sorts of social anomalies. Having a coordinated approach to therapy and really making sure that everybody is on the same page and is being consistent with the child is something that therapists and teachers are really great at. I love working with kids who are different and fun, and pulling out all the positives and that child's strengths in order to enhance their weaknesses. It's really rewarding.
So for families wanting to know how their children are going to turn out when they're older, they need to be aware that individuals with Fragile X can be affected in a wide range of ways. Some will be extremely affected and may have difficulties, extreme difficulties, communicating, and may not be able to work in a job. They, in all likelihood, will be able to live in a community residential unit, a shared housing with other people with a disability, and will be able to attend a day program. Some will do extremely well and be able to get a job in areas such as horticulture or gardening, hospitality, so working in a cafe or restaurant, childcare, or in retail. Some will be able to drive a car, some will be able to live with other people or occasionally by themselves, but most will need a level of support throughout their lives.
I want him to eventually be able to live, probably not on his own, but hopefully in some sort of group setting, just to be able to know that when I go to my grave that he's going to be looked after, that he'll be fine. That's all you want.
People with Fragile X syndrome have some very real strengths. They tend to have a wonderful sense of humour, and they engender being liked. People like working with them, they like spending time with them. They often have great memories and excellent imitative skills, which is something that can be utilised when they're young in teaching them things in school settings, and when they're older in training them in different jobs. They are very much the same as anyone else, same as you or I, but they often need help to understand the world that they live in.
The diagnosis of Fragile X syndrome is not a bad diagnosis. It just takes you in a different course in life and different problems to deal with than raising normal kids.
It used to be thought that the people who carried the premutation were entirely unaffected, that they just carried the gene. But we now know that a percentage of those people will have milder symptoms that are typical of Fragile X syndrome. They may have had some difficulties with social interactions, problems with communication, learning problems at school, anxiety and depression. There's also two conditions, Fragile X premature ovarian insufficiency, which will lead to early menopause, and Fragile X tremor ataxia syndrome. This consists of a Parkinson's type condition with a tremor, a shaking of the hands or legs, a difficulty with walking, and a dementia.
When I found out that I was a carrier of Fragile X, I think the first thing I thought was, I can't believe I've done this to my children, or Connor. And then I went through the process of how does this impact me, and that's really scary. Because now I'm not only scared for my son, but I'm scared for what it's going to do for my health and how that's going to impact my ability to look after him.
When I got my test result back, I knew it had to be me because only mothers can pass the gene to their sons, but still seeing it in black and white, I felt very guilty that I'd passed it on to Bryn, and now he has to live with this condition that I've given to him. And I think that was the overwhelming feeling. I felt guilty for my partner because now he's got children that he has to watch suffer with the condition that I gave them, not him. So that's been very difficult, I think, for me and for my sister.
You feel guilty. That's the main thing, knowing that it came from you. But I was lucky in the sense that Will was my second child, and I had no intention of having any other children, so I didn't have to go through the decision, will I have any more, will I not have any more? That I was quite happy with two, and that was all I was ever going to have.
The advantages of getting a genetic diagnosis is that most families are very relieved to know that there's a cause of their child's or their relatives' difficulties in life. It explains a lot of things that they'd often wondered about and gives them options for targeted treatment and management strategies. Although people may become upset and go through a grieving process, it's important for families to know that they will go through the process normally and come out just fine at the other end. If an individual has had a diagnosis of Fragile X syndrome, because it's an inherited condition, it's very important that other family members who are at risk of carrying the gene are identified. This means contacting those family members, letting them know they are at risk of carrying the gene, and suggesting that they see their doctor to be tested.
Now that we've started testing everybody in our family, we've got 5 family members that have come back positive, and we've got a couple of family members that we're still waiting on results for. So immediately around me, my sister and her son and my son have all been tested positive for Fragile X. I think for us, the most shocking thing was that there was just no sign of it. Everybody's very confident and very successful in their lives, and we would have possibly said that we were all a little bit anxious and socially not quite secure. But apart from that, we wouldn't have guessed in a million years that we were carrying the Fragile X gene.
Anybody who has features of Fragile X syndrome, so that's developmental delay, autism-like features, learning difficulties, should be tested for Fragile X syndrome. The other group of people that should be tested are relatives of anybody with Fragile X syndrome, anyone who's had a previous one of the older cytogenetic tests for Fragile X syndrome, women with ovarian insufficiency or early menopause, and also men with the Fragile X tremor ataxia syndrome, which is a Parkinson's-like presentation with tremor, shaking of the hands, wide-based gait, and an early dementia. For families who carry the Fragile X gene, providing that they're aware of their genetic diagnosis prior to becoming pregnant, have the following options. They can elect to go ahead and become pregnant, go ahead and have an affected child. They can elect to go ahead and become pregnant, be tested in pregnancy, and then have a termination of pregnancy if they so desire. They can go through an IVF type option called PGD, or pre-implantation genetic diagnosis, where the embryo is tested and only the healthy embryo is implanted. Or they can elect not to have children and perhaps consider adoption.
I would say to people who are just finding out or even just suspect that they might have Fragile X in the family is to be open and talk to as many people as you can and gather as much information as you can, try not to be overwhelmed by it at the same time, and just, you know, keep focusing on that child that you've got that is still so beautiful and is still a person and still your child, and that puts it back into perspective. Whatever's going on every day, you've got this beautiful little person in your life.
Don't lock yourself away. Ring the association, because that's the first thing I did. As soon as Will was diagnosed, the first place I rang was the Fragile X Association. I got the parent helpline, and from there it's fantastic, because I met so many people, and all those people had children of different ages and had been through what I will be going through in the future.
Trust yourself. As a mother, you know your child and you know if there's something wrong, and if you feel like something's not right, then don't let medical professionals put you off. Keep looking and keep looking for help.
It's very important to know that the children with Fragile X syndrome live in a family. It's a family issue, it's multi-generational, and everyone in the family needs care.
My recommendation to families with an individual, whether it be a child or an adult with Fragile X syndrome, is to make sure that they consult with a wide range of people that offer their family member the best options for their life.
Expect the unexpected, because they'll always surprise you, and every milestone, just celebrate it, because it's fantastic. It just means so much more.
Fragile X syndrome is the most common inherited cause of intellectual disability and single gene cause of autism. It is caused by a lengthening of the X chromosome known as a gene mutation. The X chromosome is one of two gender-determining chromosomes. Females have two X chromosomes, males have one X and one Y. Normally, the X chromosome contains between 6 and 50 repeats of a gene responsible for producing a protein vital for normal brain development. In some people, this gene may contain between 50 and 200 repeats. This is called a Fragile X premutation. A person with this premutation is called a carrier. Fragile X syndrome is caused when this gene lengthens to over 200 repeats. The Fragile X gene may be passed down through each generation. Daughters born to male carriers will inherit their father's affected X chromosome. They will also be carriers. Sons born to male carriers will not inherit their father's X chromosome and therefore will not be affected by Fragile X. Because females have two X chromosomes, children born to female carriers have a 50% chance of inheriting the affected gene. If the gene is inherited, they will either be a carrier or have Fragile X syndrome. There are a wide range of treatment and management strategies for people living with Fragile X.
I'm sure you may have more questions about Fragile X syndrome or Fragile X carriers, and you can contact the Fragile X Association of Australia, and they can give you plenty more information about Fragile X.